Hello everybody, I'm Dr. Amit Mulay. I'm a plastic surgeon practicing in Pimpri, Chinchwad and Pune area in India, and today we are going to talk about a very common condition which is called as gynaecomastia. So gynaecomastia is commonly called as man boobs by lay people, and what it is actually, it is enlargements of the breast in a male. It's a very common condition, but it is a relatively harmless condition. There is no threat to the patients. So what are the causes of gynecomastia? Gynecomastia is basically caused by hormonal imbalances. There might be either increase in the estrogen levels, which is a female hormone, or it might be because of decreased testosterone levels, which is the male hormone. So what are the common conditions in which you see gynecomastia? Most commonly, gynecomastia is seen in adolescent guys, the guys who are coming out of age, and there is this hormonal imbalance related to this adolescence which causes gynecomastia. Another common cause is old age because there is decrease in the testosterone levels. It's also seen in infants where under the influence of maternal hormones there is increase in the gland size. Some liver and kidney diseases also cause hormonal imbalance leading to gynecomastia. Thyroid dysfunction, either increased thyroid hormone levels or decrease in the levels, cause gynecomastia. Some tumors of testes are known to cause gynecomastia, chromosomal abnormalities, and there are even some drugs which cause gynecomastia. So what is the treatment of gynecomastia? Whenever you go to a doctor for gynecomastia, he will advise you some blood tests, and what is the reason for this blood test is that you have to rule out any systemic disease of liver and kidneys, and you have to rule out hormonal imbalances. The doctor will also perform a physical examination to examine your testes, to examine your abdomen, to examine your neck for any thyroid swelling. Sometimes medicines may help in a few cases, and these medicines are generally prescribed by endocrinologist. But by far the mainstay of treatment of gynecomastia is surgery, and by surgery I mean it's liposuction. So what is liposuction? Liposuction is basically a pretty straightforward procedure. It generally lasts for 1 to 2 hours. We generally give local or general anesthesia for liposuction, and what we do is that we inject fluid around 400 ml to 1 liter in the chest wall, and the gland is broken with the help of cannulas, and then it is sucked out with the help of suction machine. So here I am going to show you a few examples of gynecomastia case. Patient has grade 2B gynecomastia. You can see there is huge amount of enlargement, there's good amount of ptosis, and this is the before picture, and then you see the after picture, and here you can see that the scars are almost not visible. Let's come to the second case. Here it's again a 2A gynecomastia. This patient has grade 2A gynecomastia, small enlargement of the breast, and this is the before picture, and you can see the after picture, and here you can see the very minimal amount of scars here which are almost as good as not visible. So what are the advantages of doing liposuction over conventional surgery? One, it leads to early recovery. Second, it has minimal scarring because of liposuction. The pain is minimal, and the cosmesis is definitely better with liposuction. So how is the recovery from liposuction like? We generally do suture removal after 10 days. We prescribe pressure garments for 3 to 6 weeks. Pressure garments are basically tight shirt kind of thing, which has to be worn for 3 to 6 weeks. The physical activity of the patient has to be restricted for at least 3 months after surgery. Patients have to expect some kind of bruising around the chest wall for 2 to 3 weeks, which will go off spontaneously. Thank you very much, and do remember to contact me. On the underside of this video, you will have links to my website. Do visit my website and do visit me if you have any further queries. Thank you.